My name is Kinney. I am a registered nurse at Phoenix Children's Hospital. I am also a certified diabetes care and education specialist. So what that means is I work in a specialized clinic at the hospital taking care of children who have type 1 and type 2 diabetes. But I decided to specialize in diabetes, and I have been working for almost a year in the diabetes clinic. So part of my responsibilities, I do a lot of math, which is very fun for me. I love numbers. I do insulin adjustments for children. So I work very independently as well as alongside doctors to help care for these children who have diabetes and help them live their best lives, whether that be helping them learn new technology and teaching them about using their cell phone and insulin pumps and other smart devices to help make their lives easy and to also help make their lives feel like they don't have diabetes and it's just part of their, something extra that they do. There are two main types of diabetes. There is type 1, which you may have heard as juvenile diabetes. There is also type 2. Both of them are very different, but also can be similar. So type 1 diabetes is an autoimmune disease. What that means is your body attacks itself and destroys the cells in your body that produce something called insulin. Insulin is a hormone that helps regulate your blood sugars. What that means is if your blood sugar goes up, insulin is made and it helps bring your blood sugar back down. So for kids who have type 1 diabetes, they don't produce that insulin. So what happens is we have to give it to them in the form of a shot, or it can be administered through a little pen or an insulin pump, which has tubing and is connected to the body and gives insulin. Type 2 diabetes, it's where you're not as sensitive to insulin. So your body is producing it. However, you're not making enough to help bring your blood sugars down. I absolutely love what I do. I have wanted to work with kids my whole life. I love kids. Part of my job I get to do is figure out math problems, complicated math problems, and figure out, okay, if I raise this number, what's gonna happen to this kid? So that's part of my job, is using math and logic to figure out how what I change in a child's life is gonna affect them. I've always loved math, like I said, and science, and I wanted to work and teach others. So I've always been between teaching and nursing. And when I got to high school, I really explored that. I took an anatomy and physiology course in high school that really I enjoyed. And I kind of decided I wanted to do medicine. I went to a camp that was in a hospital, and I got to explore the hospital, get to watch doctors and nurses, and got to see a live open heart surgery, which was really, really cool, and just explore medicine to make sure I wasn't afraid of it. So I really enjoyed the medicine part of it, and I didn't want to give that up. So I found that nursing was a perfect, hybrid and amalgamation and just a joining of all the things I wanted to do.